Is fees the right tool for my practice? Top 3 myths about fees. The modified barium swallow study has historically been labeled as the gold standard for instrumental swallow evaluations. But what about fees? What can it tell you that modifieds can't? Isn't this super invasive and uncomfortable for patients? Well, there are a ton of myths out there about fees, and I'm here to help you bust several of them to help you decide whether or not fees is the right tool for your practice. So let's dive in. I'm Theresa Richard. I've been a medical speech pathologist for 15 years. I'm a board-certified specialist in swallowing and swallowing disorders. I'm the founder and CEO of the Med SLP Collective and Med SLP Education. So my initial reaction to this title is, yes, of course. Fees is a wonderful tool and should be used as a primary tool of diagnostic assessment for so many settings in our field. It is a tool that SLPs can use autonomously to diagnose dysphagia without other professionals involved. Despite the convenience and lower cost of the facility for performing fees, many still argue that video fluoroscopy is the gold standard when assessing swallowing functioning. Dr. Susan Langmore, who first documented the fees procedure back in 1984, notably stated that although video fluoroscopy was first to the market, doesn't necessarily make it better. In this video, I do not wish to argue which assessment is better, but rather make the argument that due to convenience, cost savings, and clinical findings, fees should be performed first. This would allow for more patients to be evaluated in a shorter amount of time, leading to decreased length of stay and lower costs of the facility. Once the fees is completed, the SLP has the option to perform a video fluoroscopy or other GI exam or referral if needed. One of the main reasons fees has gained popularity in recent years is because of its mobility and portability. Fees can ultimately be used in essentially any setting now: acute care, ICU, skilled nursing, private practice, home health, although some states do have regulations about fees being done in the home or in an office building. So check those out. But the reality is now we truly can do fees anywhere. Fees is not painful. There's many misconceptions about the pain that fees causes or doesn't cause, and if anything should be used to reduce that discomfort. Leader and colleagues found no significant difference in the comfort of fees even compared to using an anesthetic, saline, or a placebo. 2003, Cohen performed a study of 349 consecutive fees exams where patients were asked to rate the level of discomfort with the procedure. 12.6% of patients stated there was no discomfort, 48.4% thought it was mild, 31.5% described moderate discomfort, and 7.5% said it was severe. 98% of the patients stated they would repeat the test in the future. It's important to note that state regulations may not allow the use of lidocaine unless administered by a physician. I know personally when I was trained, we were told to use saline as well, but then I lived in a state where we weren't allowed to administer saline, so we stopped. Now I will add that fees is much less painful and uncomfortable if performed by someone who has extensive experience performing fees. I was at a training where brand new clinicians were learning to scope, and they were scoping each other, so brand new clinicians were scoping brand new clinicians. I was watching one SLP in particular. She didn't want any guidance or any help in navigating the scope from the trainer, and instead she just kept poking the scope into the other poor person's nose. The other girl kept saying how incredibly painful it was, and she didn't want to do it anymore. I went over to them and I explained that they're all brand new at doing fees, and none of them are good at navigating the scope yet, and that's okay. I asked one of the girls if she would mind if I scoped her. My biggest fear would be that they would leave and just continue to perpetuate that fees is painful, because this has happened. Lo and behold, she said, "Oh, it's not that painful after all. It just feels a little weird." Do you have a question about fees? Leave a comment below and I'll be sure to get back to you ASAP. I'll be posting other videos just like this one that you won't want to miss, so make sure to hit that like and subscribe button, turn on the notification bell. Fees is dangerous. Langmore 2017 states that fees has been shown to be extremely safe, with all reported complications being minor and spontaneously resolved. In a prospective study of 1,340 patients by Dr. Aviv et al. In 2005, epistaxis occurred in one patient, 0.007%, with no airway compromise. In a 2003 study by Cohen, mild epistaxis occurred in 4 patients, only 1.1%, with no episodes of airway obstruction or laryngospasm. In 2009, Wernicke et al. Did a study of 300 patients that were within 2 days of a stroke. Many of them were even on anticoagulants. They showed no epistaxis, no change in mental status, laryngospasm, or brady or tachycardia requiring special treatment. And a study of 2,820 patients showed 4 cases of epistaxis, 0.14%, 3 cases of vasovagal syncope, 0.1%, and 2 cases of laryngospasm, 0.07%, with all resolving spontaneously. I did fees at a facility a few years ago where I had a great long-standing rapport with the organization. Someone new came into administration and immediately said that fees was too dangerous to be done anymore in their facility, and they would not be offering it. I was totally crushed that all of these patients who had access to fees previously now no longer did. I called up the medical director, who was a huge fan of fees, thank goodness, and all that it had done in that facility. And we pulled out all of the statistics that I previously mentioned, and he was able to convince that administrator that it absolutely is safe to do in that setting. I've got a free gift for you over at medslpcollective.com. Check out the free Med SLP Collective clipboard kit for access to editorial reviewed resources on fees myths. To download your free copy, head over to medslpcollective.com/clipboard, where we also have a robust and vibrant community of SLPs and mentors to help you out with your toughest clinical cases.